We're going to start in just a few minutes. We go live on HW Cam in about 1 minute. I'm just waiting to see all the panelists, make sure they're on. So stay tuned. And please keep your mics muted for right now. Thank you. Good afternoon, everybody, and welcome. It's great to see all our residents' faces. It's been a long time since we've seen you at Town Hall, so we certainly miss you. It's been a challenging time for all of us. Thank you for hanging in there, and we'll get through this together. So first, I want to introduce our panelists for today. The first person I want to introduce is our public health nurse, Miss Mary Beth Ting. Our captain, police captain, Kevin DiNapoli, our fire chief, Stephen Kavanaugh, Board of Health member, and also a registered nurse, Regina Baker. And then I'm going to be your moderator. So we're going to start by having Mary Beth give us an update, and I'm going to turn it over to her right now. Mary Beth.
She was just talking on Channel 8.
Mary Beth,
Hello,
there you go.
here I am. Sorry, I was having trouble getting unmuted.
Unmuted, yeah.
Good afternoon, everyone. I had trouble, Anthony, I missed your intro because I was having trouble getting my audio connected. So the first thing I heard was Mary Beth.
I just introduced everybody, all the panelists.
Okay.
And then I threw it over to you to give the community an update that you normally would do for the selectmen.
Okay, great. So it's nice to see everyone. Welcome to our first public forum. I'm so glad that you've come. We're going to talk about COVID-19. My job is to give you a little update of where we are right now in the town of Wenham. I don't know if any of you have been following the mass.gov website to look at the case counting that has been reported. Up until very recently, I think up until the 15th, case counts were reported daily, updated at 4 p.m. by county only. And starting just yesterday, the state is now releasing data by each municipality in the Commonwealth. So we can all look on a daily basis to find out what the case counts are. And I will tell you that currently in Wenham, we have had 7 individuals who we've had confirmed laboratory testing that they've been infected with COVID-19. Thankfully, 6 of those people have recovered and completed their isolation. We have had a number of people who have been close contacts of those who we've been following, checking in with. I contact them daily and check in how their temperature and symptoms are, and to provide education and support. And most of those people have cleared their quarantine as well. We are in no way out of the woods. Part of what happens with this virus is that who we know is infected is based upon who can access testing. And as I'm sure many of you have heard on the news or been reading in the papers, getting access to testing is a problem. It's getting better and better in Massachusetts, but we still have a ways to go for everyone that needs access to a test to actually get that access. Additionally, some of the guidance has changed. Initially, we were looking at people from very onset of when they started to feel ill. Now we know that we need to be talking to people about who might you have been in contact with in the 48 hours prior to your feeling ill. So as you might know, the Board of Health just recently passed an order at their meeting last evening requiring that residents, if they're using essential businesses in Wenham, to wear a face covering. And that means something that will cover the mouth and the nose. There's information on the COVID-19 webpage of the Town of Wenham website to give you more information about how to make your own from things that you, fabrics and things that you have right around the house. So that's partly in response to the fact that people can be infectious prior to them knowing that they are ill. That's fairly common with many infectious diseases, and it's true with the coronavirus as well. So I think that's the what I'd like to start with as an update. And certainly we're happy to have questions. We're very grateful for the questions that have been submitted that we'll talk about, as well as any questions that might come up during this forum. Thank you all for attending.
Thank you, Mary Beth. And now we're just going to have each of the other panelists just give a brief little update and overview on what's been going on in their part of the world. Captain DiNapoli, Police Department.
Sure, thanks. Good to see everyone again. It's nice to see some faces we haven't seen in a while. We've been, as Anthony had mentioned, and we've been meeting regularly as a group, and it's been going really well, staying on top of things. As far as police specific, we're doing regular check-ins, which we've been doing, and now we have a table set up specific to our employees that we're having. Employees at the beginning of every shift check in to make sure we're heading things off at the pass. If God forbid there's a scenario where somebody was symptomatic in any way, shape, or form, we would want to stop that in its tracks. And we're, and I'll get into it a little further as we move along. We're doing great with our equipment and our procedures that we've been going forward with. So it's been a nice team effort across the board, and I'm happy to be a part of it.
Thanks, Captain. Chief Kavanaugh.
Good afternoon, everyone. Nice to see everyone. On the fire side, we have in fact locked our doors. There are signs up on the building. If you need help, there is a phone outside that you can dial 911. Goes direct to the rec center. We are doing some inspections, but not a lot of them. And I want to touch a little too on what to expect to see from us. We are answering every single call, and we are doing it a little differently on the medical side. And if you dial 911, they are going to ask you at the rec center a bunch of specific questions. We will respond in the ambulance. And if anything is COVID related, you will see one person go to the door in a gown, a mask, glasses, and gloves. And if you are not able to ambulate to the door, we will dress another person and go in and retrieve you and get you into the ambulance and transport. It's a little different than what we used to, but we are coping with it.
Thank you, Chief. Regina Baker, anything Board of Health?
Hi, I'm Regina Baker. Yes, I'm a member of the Board of Health. Most of what I would say would reflect the work that Mary Beth has done behind the scenes, along with Jackie. I think that the board, together with all the work behind the scenes, has been proactive. Like early February, we started to work on this and some dialogue, and we've had more meetings than we routinely do, bringing information in from the research, just from what the epidemiologists are showing, and also following through, kind of reflecting the lead from Governor Baker. I think we're working well together, focusing on keeping the community safe and doing the best that we can to stay ahead of this, to flatten the curve. My other side of my life, I'm an ER nurse, and I see a lot of this coming and going. A lot of the cases that we don't see reflected in actual test positives, but actual cases out there that are sent home to quarantine with assumed COVID. So I'm grateful to be on the board, to be helpful in this and help the community. But and I think everyone's been doing a great job in the community as well.
Thank you, Regina. So I do have some questions that were submitted in advance, and those that are on the call right now, there's a couple ways that you can do it besides the ways that was talked about in the website. But through Zoom, you could raise your hand, or you can also just go into the chat function and just chat and type your message, or you can kind of do this. And I have two screens going on, so I'll try to recognize you and answer your questions and call on you. So I'll start with the prepared question. And this is multi-parts to it. I guess this would be addressed to Mary Beth or Regina. Should we be wearing masks in the car, or when we take a walk, bike ride in the neighborhood? Do we have any idea how long the virus can survive in the air, open and closed spaces, or how it travels? If someone is contagious walking on Cherry Street without a mask, could that virus migrate over to Kimball through the air? Mary Beth, want to take the first shot at that?
Yeah, so that's a multi-part question.
Multi-part question. I'll repeat any part you need.
Okay. So in terms of what do we know about how the virus is spread, the thought is that it's mostly through droplet spread. And so what that means is usually your cough or your sneeze, or potentially even with your speaking with another person. So that's why we've been talking about the physical distancing of 6 feet, that if you're in a closer distance than that in regular conversation, there's the potential that you can be through your speech, some droplet spread. I did check, I was doing I had seen some of the questions ahead of time and looked ahead, and according to the WHO, it's mostly through droplets generated when a person coughs, sneezes, or speaks. These droplets are thought to be too heavy to hang in the air. They quickly fall on floors or surfaces. You can be infected by breathing in the virus if you are within 1 meter of a person who has COVID-19, or by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. So that really brings us back to the common prevention strategies that we've been talking about really since January, which is frequent hand washing, because if you've touched something and then you touch something else, you can contaminate yourself. Also, not touching your eyes, nose, and mouth. Again, you could contaminate yourself. And the more recent guidance that we're suggesting is using a face covering, so that if you are not able to be at a remove from a person at 6 feet or more, you're containing any droplet that you might be sharing. And then the stay at home is because when you cover your face, that's protecting the public from you if you might be infectious and not know it yet. The stay at home is to protect you from other people being exposed to other people where this virus is very contagious. So I believe
very contagious.
Sorry, I'm getting feedback. Wait
Okay.
just a second. I believe that should answer the question about, can it go from one street to another? The thought is that the droplets are heavy and will fall to the ground, so not necessarily passing so much through the air as much as when you're in close proximity with another person. There was a question about, should I be wearing a mask in the car? I can speak to my own practice about that. Generally, when I'm in my own car, I don't necessarily wear a mask, but this does bring up what your hygiene or how you should take care of things around a face covering. Generally, before you put on a face covering, you want to wash your hands, and that's either Soap and water with 20 seconds of good friction. Pick your favorite song that you lather up to, and then rinse your hands off and dry them with a paper towel, hopefully. If not, if you're in the car or you're going to be out and about, then you want to use an alcohol-based hand sanitizer. You put in about a dime size and you rub your hands until that hand sanitizer is completely absorbed by your skin. So you want to wash your hands, hand hygiene prior to putting the mask on. And then whatever you're using to secure it, you only want to touch that bit of it. And I should have I'll remember to get my face mask before we finish this form, but you want to handle it by the ear loops or
Here.
the ties. Oh, Jackie's showing you right now.
Oh,
Oh, and so is Regina. Excellent. So you only handle it by the straps on the side. You never want to be touching the front of it because that's the part that is likely going to be contaminated. So you just touch it from the ears and put it on. And then you don't want to, when you're first putting it on, adjust it to how you need it. And then you stop touching it until it's time to take it off. So I myself, if I actually went grocery shopping today, I did my weekly shop. And when I was ready to leave my car, I did my hand sanitizer. I put on my mask. I did my grocery shopping. I finished my grocery shopping. I put everything in the car. I got in, I did my hands, I took off my mask by the loop. I keep a paper bag because I'm reusing mine. So I just stuck it in the paper bag so it's not all over everything in the car. And then I did my hand sanitizing. So I would say if you're out and about for performing essentials, then it's up to you how comfortable you feel about your ability to manage this new task of putting a face covering on and off. I would say that if you need to transport someone to a testing site, if you have a family member or yourself and you're going for testing for COVID-19, then whoever is going for testing should put a mask on. Absolutely. Anthony, what were some of the other pieces of that question?
Well, the next question plays into what you already said, and it had to do with quarantining items in the car, including face mask, which I think you just said that you put your used face mask in that paper bag.
Yes, that's
And
what I
then-
do.
And then there was mail and groceries.
Okay, so I did also look that up. The WHO addressed that as well. How long does the coronavirus last on surfaces? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. And you may or may not have heard that this particular coronavirus comes from a family of viruses called coronaviruses. The common cold that many of us experience belongs in that family as well. So we're not it's not as if we have no knowledge of how these things behave, but this one is new. And so we're learning more about it. But studies suggest that coronaviruses, including our initial information about COVID-19, may persist on surfaces for a few hours or up to a few days. But later on in the WHO website, it reiterates that most infection is really thought to come from the droplet spread, from being exposed to an infected person, not necessarily that the viral load is as much on the contaminated surfaces, but it's still important to disinfect our surfaces and remember the hand hygiene and not touching your face.
Thank you. If
Yeah.
there's any questions for those that are on video, again, if you just wave, I'm trying to look, I'm happy to jump in and take a question from the viewers. Or again, you can use that chat function in Zoom. Next question. Is it true that there is a serum test in the making that will allow people to be tested for the antibodies and to see if we were already have immunity?
Regina, you let me know when you want to grab a question. I don't want to be hogging the show.
I mean, you may know more as far as the research on that. I've just what I've heard through the media, they're trying to develop, they're working on different tests. They're even looking at just a finger prick test. So different advances in that. But yeah, I know the real benefit of having the serum test is to know who's immune, but one of the things that they're trying to do is identify who has had the disease, and they have the tracking collaborative that they want to do, and they'll follow who people have been exposed to, where the disease has traveled. So there's a couple of levels on that. One, to find out if you've had it once they develop fully the test, and then the other is to learn more. Again, it's a novel virus. We don't have a lot of background on it, so we're learning as we go, but it will give us some more information on how it actually does travel. So it would help with preparedness. But Mary Beth, you might know more about where they're at in that testing.
Still definitely under development. I know that it's being studied and tests are being developed. And I would say that with this crisis, there's a lot that's under development. There are treatment protocols that are under development and in clinical testing. There are vaccines that are under development. There's a lot of work and development going on. On the radio today, I even heard about it, work that's being done, I believe through MIT. That could be wrong, but one of the technological institutes of higher education is working on a saliva test, which would be beneficial in terms of reducing the massive need for personal protective equipment for those that are administering the test. That would make it easier and less risky for the healthcare workers. So there's a lot that's being in development. I would say that one of the things we continue to hear from the epidemiologists at the state and public health officials at the federal and international level is we don't currently know how long immunity will last. So for our individuals that have had COVID-19, the assumption is that they have immunity, but for how long, we're not sure. And we're trying to learn from other countries like China what is happening with people when they've recovered. Are they going to be at risk for reinfection at some point?
To add on that, Mary Beth, so that was one of the next questions too. So if somebody is immune, could they still touch something and pick up the germ and pass it on to somebody else if they're immune?
One of the news items I heard just on the radio today was that individuals who have recovered may test positive again. There's a couple of reasons for that. The test that we're using is a PCR test, which stands for polymerase chain reaction test, which is very, very sensitive for the virus. And so it will pick up any aspect of the DNA of the virus. So sometimes someone could be infected and recovered and still test positive because it's picking up the DNA of the virus, but it doesn't necessarily mean that that person is still infectious. It may be dead DNA that's picking up in that sample. But the issue I was hearing on the news just today was that there could be times that someone has fully recovered from COVID-19 and may still be reinfected, have viral shedding without any symptoms. Sort of the point that they were making was sort of how when you've had the common cold and you recover, you may be infectious to other people, although you're not sick yourself. But I would say that that was just something breaking news that I heard today. And we really have to wait. Time's going to help us understand the science of this virus better than we do currently at this point in time. So Anthony, unfortunately, the answer to a lot of these questions is we don't fully know yet. And
Right.
that would be the answer to that question.
I did see on that, again, we still don't know. There was an article in the New England Journal of Medicine regarding that. And the thinking was that up to 14 days after someone has recovered from the virus, they may possibly still be able to spread it, and possibly up to 21 days, but still it's something they're looking into. And that was one of the findings in a recent article. We're still learning.
Yeah.
So.
Which again, not to be a broken record on the prevention measures, but I will be a broken record on the prevention measures. It makes it so important to just stay home. You know, unless you absolutely need to be out, you just need to stay home.
All right, so we have a question from Emmy. It says, what is your recommendation for those who are taking the hydroxychloroquine and are now facing a and are now facing a pharmaceutical shortage. Does the state have a plan to address this?
I don't have a ready answer for that one. That's one that I could certainly ask officials at the state about. I'm not aware of a plan, but that does not mean that there is not a plan in place. My head has really been down into the nitty-gritty of residents of Wenham. I haven't had a lot of exposure to individuals who are on any sort of therapeutic regimen at this point in time. So I'm glad we have that question written down and we can look into it, and I know who you are, so we can get you an answer.
Another question is, we all love our dogs, and can dogs interacting with each other pass it on, and can that be passed on to their owners and vice versa? I know there's been some recent new findings on that. What do you know about that?
So in light of the poor tigers at the Bronx Zoo, I looked into it again today because as many people might have heard, it was a big news item that there was a number of big cats at the Bronx Zoo who tested positive for COVID-19. And it's believed that they contracted it from a human who was caring for them. The WHO and CDC continue to say that there's no evidence whatsoever of companion animals carrying or transmitting the virus to their companions, their human companions. The CDC website, if you look at it, does recommend that if you are infected with COVID-19, that you have someone else care for your animal. They don't go into detail about what the thinking and rationale is behind that. But what I have consistently seen is that we don't necessarily need to be worried about our animals transmitting it to us, but more that we could transmit it to them.
I think another way to look at that as well is if you're in your home, you have your animal, you touch your animal, we're all over our pets, and then whatever's on us is on them, and then they go play with another animal. Dogs play, they like to play, then they're transferring the contact part of that to that other pet, and then that goes into the next household. The pet could also be a carrier, because we don't know how long it lives on surfaces. Just a thought on that. Again, washing your hands, no matter what, every time more often than you ever would, wash your hands. So. Thank
you. Looking at our viewers, does anybody have any questions that you may want to ask regarding COVID or the town or anything else? All right, I'll jump into the next question. Regina or Mary Beth, is it possible for somebody that has the virus to get it again?
I think I did touch on that earlier, and the answer is we don't know yet. We don't know how long the immunity from this virus will last. And depending on how this pandemic unfolds, if we're looking at it on a much longer term trajectory, it's possible, but we just don't know yet. If you think about other coronaviruses like the common cold, sometimes people get a cold and then get another cold. Sorry, enjoying my 11-year-old coming on in. And then getting another cold throughout the season. So it's possible, and we just don't understand yet.
Thank you. Yeah, we seem to run into a lot of that with Zoom calls, huh? These little things that happen. I guess it's maybe a new way to do work. There's just another comment here. This is probably for all of the panelists. Thank you for all your dedication and hard work. Super grateful for you and to live in this town where you're doing a great job communicating and caring for us. Speaking of communicating, if hopefully everybody feels like they're getting enough information from us, we're trying to do our best with our limited staff, and big shout out to Nikki Robach, who really works very closely with Mary Beth, the Board of Health, myself, and keeps as much information that we possibly know of out there for those at home. So, all right, next question. I think we touched upon this. It's number of cases in Hamilton and Wenham, and you mentioned that the DPH is now posting that. Is that daily, Mary Beth? Did I see that right? It's going to be a daily,
It is,
daily
yes.
update.
Mm-hmm.
And we can just go on. I think it's mass.gov/COVID-19, and then it'll give the daily update after 4 o'clock every day, right?
That's right. That's
Yeah.
right. I don't want to speak to the Hamilton number. I know earlier in the week, they had a total of 11. But I don't know if that's changed since the beginning of the week.
It also is in the Boston.com that I saw that they had a link there to them. I thought I saw 17, but that could be wrong. Next question is regarding debts. How many debts in Hamilton and Wenham, and how is the town enforcing social distancing? That will be one for the police department, and other regulations to help slow the spread of the virus. So, Mary Beth, do we have a death count on 0 in Wenham?
I'm very pleased to say it's 0 in
Yeah.
Wenham. I don't believe that is the situation currently in Hamilton. I'm sorry to say, I believe there have been at least one.
At least one. Yeah, that's what I had heard. At least one, possibly two, but unconfirmed at this point. Captain DiNapoli, how is the enforcement going? Is the police had to do anything, or?
Yeah, fortunately, it's all been verbal warnings, which is ideally what we want to have to do. Obviously, money fines is the last thing we want to put our officers in a position to have to enforce that. Most of our enforcement has been down at Pleasant Pond, folks going around the barricades and either driving their cars in there or walking down there. We have gotten quite a few calls for that. And then beyond just the calls, the regular patrols of the guys identifying that. But so, and I got to tell you, the folks, when they are addressed, 99% of the time are super cooperative and respectful and just move on their way. So we've been doing that on a regular basis. But other than that, knock on wood, obviously, as we talked about in our regular briefings, that the nicer, warmer weather creates more of that, either at the rail trail as well. And, with the parking enforcement has gotten better since we've been able to post it more. Folks are more aware of where they can and can't be, and there's been very little outright violation of that with the proper signage now in place. So we've been pretty good there.
Great. All right, next question. Is there any thought being given to the town acquiring face masks for the distribution to town people? It's particularly important as we need to wear them constantly in public. No, the town is not looking at buying them for everybody. We're doing all we can to make sure that our public safety folks have the necessary PPE. So I think that there's been a lot of great suggestions that we've seen through federal and state level as far as making your own face covering, using the bandana, and really leaving the N95s and that type of equipment to our medical professionals. Anybody want to add? Fire Chief, I know that you and Jeff have been working hard on keeping up with the PPE here in town.
Yes, we have enough for ourselves. We actually have also had people making them for us, the cloth ones that we can wear, when we go out. But other than that, we don't have any extras, and it is hard to get them. But I would go to your local hardware stores. They do have some, and they are limiting how many you can get if they have them. But other than that, I would make your own with a bandana or there's so many great ideas out there on Facebook.
Mhm.
A lot of people making them.
Oh, go ahead, Mary Beth.
I would also say that we do have a small supply that we have received through the generous donation of the Hamilton Wenham School nurses that we have shared out with a Court Food Pantry and some with the Council of Aging for their staff. And we do have some supply of not respirator masks necessarily, but surgical masks that we will be distributing for families that need them if they've got a family member in isolation and the other family member is taking care of that person, would need to mask up when providing direct care or meals or things like that. So we do have a small supply. It's not endless by any stretch, but when I am interacting with families that are affected by COVID-19, these are the sort of questions and supplies that we're asking about. Do you need these things? And trying to make those available.
Thank you.
And-
I'm sorry, Regina, go ahead.
I was just going to emphasize that the CDC guidelines, as far as non-hospital or medical workers, the cloth masks are just fine. Going out in the public, shopping, getting food, things like that, the cloth masks, and there are several things on the web to find out how to make them. Pretty simple, but they work. Just I wear cloth masks when I'm out and about, and surgical masks are left at the hospital, so they work.
Thank you. Early on, one of our concerns in our, we have public health, public safety meetings 3 times a week in the morning, Monday, Wednesday, Fridays. And one of the things that we recognized early is we wanted to make sure our most vulnerable population, those being over the age of 60, that we use 60 as an age, that we tried to check on them. And we've been trying to do phone banking. And question came in, Jim, not to put you on the spot, but the person that asked the question, and let me see, it was Lucy, I'm sorry, Lucy, I got to put my glasses on. Jim, what's going on as far as, give an update on how you've been doing as far as contacting those 60 plus residents? You're muted. Yeah.
Well, this, hold on one sec, I'm hearing a little echo. So as far as our reports coming in, we've contacted over 500 of the 1,050 people that we had on our list of people 60 and over. And we're encouraged by the support of these calls. I don't think necessarily everybody between age 60 and 70. Can you just turn off your speaker? Necessarily needed to be called, but I think it was a very worthwhile effort, and I feel we got a lot of positive feedback from people.
Thank you, Jim. All right. Jim, go back to.
Can I
mute
just
your
interrupt
phone.
for 1 second,
Yeah.
Anthony?
Sure.
I was just on a call with Senior Care earlier today, and I know that Jim is interacting with the other 9 communities that are served by Senior Care, which is providing meals and other services to seniors. So I know that Jim and other COA directors are actively engaged, and that there is meal delivery available to seniors and other services, so that if you do find that you desire some support, definitely reach out to Jim Reynolds at the COA. Is that okay for me to say, Jim? You're on mute, Jim.
You're on mute, Jim.
Sorry. Can you hear me now?
Mhm.
Yeah.
So yeah, those meetings have been really productive in terms of kind of informing us as to where everyone stands relative to services that are provided by both us and the other councils on aging. And so there's another group that's the Northern Essex County group, which kind of extends to Raleigh and Georgetown and some of the other communities. So there's a weekly call with them as well. So, I mean, I feel like we haven't really met very much in the last 6 years as directors of the senior care catchment area. So in a way, this has really brought us together much more than in the past. So I'm encouraged by that. And, you know, we're all learning from each other as to how to be relevant, how to be effective at you know, helping people that need the help. And they're out there. So.
Thanks, Jim. Mary Beth, I'm not sure if you touched on this, but as far as sanitizing groceries and food packaging after shopping, and any thoughts, recommendations on that?
Well, I think what you're referring to is there was a viral Facebook post from a physician from Michigan. And I think that's gained a lot of traction for how he was recommending that we decontaminate our groceries when we bring them home. I will say that just personally speaking, in my own home, my husband thinks I'm a nut, and I bring the groceries in and I do the sort of decontamination, and I do it with a little bit of, I don't know, ambivalence. I mean, I go through the process. I think, you know, when there's something like this that we can do in a time when we feel like there's so little we can do and can control, sometimes these activities that we can do help us feel like we're doing the best we can for ourselves and our families to try to be safe. And whether or not it's really essential to decontaminate your groceries, I think that's an open debate. But I think the value for those of us who want to undertake it is that it helps us feel like we're doing something to take care of those we love. And so if you choose not to do that, I would not say you're being irresponsible. I'm saying you're taking the best care of yourself that you can. And that's all any of us want to see you do right now. Just do the very best you can in what's an extremely difficult situation.
Thank you. Captain DiNapoli, what is the police procedure ensuring officers are safe and healthy from the virus?
So, yeah, as mentioned before, we have a good process. We're lucky to have Reserve Officer Mike Perry on staff, who's been phenomenal with the medical side of it. And what we're doing before and after every shift, there's cleaning wipes in each cruiser. So the officers, I mean, that's our office. That's the guys that are in there for 8 hours a day. So it's a small confined area. So we're decontaminating and cleaning those to the best of our ability before and after each shift. Even if it's redundant, the oncoming guy is doing it again. And then as we're checking in literally at the beginning of every shift, we have a table set up that's taking our temperature that was provided to us by Deputy Chief Baxter, gave us the nice digital thermometer, and we're making sure there's no other symptoms that we need to be concerned or are aware of. And then for folks that haven't worked or some of our reserves don't work on a regular basis, we're checking in with them regularly. If we can cut something off at the pass before they come in for a shift, if they are, God forbid, symptomatic, we're trying to get ahead of the curve with that to fill their shift before they even do come in to keep it out of the station.
Thanks. Chief Kavanaugh or Deputy Baxter, same question to you as far as keeping firefighters safe or the patient that has to be in that ambulance the next time you're using it, maybe?
We do a daily check-in with all our firefighters. We do check temperatures with this device right here every time the firefighters come in for a call. As far as the ambulance is wiped down daily, if not at every call. Also, after every call, it's gone through 100%, restocked, wiped down the walls, everything, just to make sure. Restocking of the gowns or anything that the guys might use, face pieces, things like that. The station gets wiped down twice a day at the minimum. And again, as far as the ambulance, also the fire trucks are being wiped down daily. The driver's area, the passengers areas, just
even the doorknobs on the doors on the outside, we wipe all those down also, all the different trucks. But our process has seemed to have been working. All the guys are they're feeling safer when they're doing what we're doing. And it just seems to be working fairly well at this time. And
Dep, are we still using the electrostatic sanitizer in the school?
yes, we are. That one that was provided by the school. We actually just did our station today. We did it yesterday also. And I know you guys just did it at Town Hall and all the other public buildings. And all the call guys themselves, because sometimes we do respond directly to your house in our personal vehicles. They were all issued a safety bag, is what we're calling it, which has respirators and different items. Somebody could come in with a Scott mask on. It has a big canister on the end. Again, that's just to protect us and also to protect the public, that we're not spreading anything back and forth. So please don't be alarmed if they are wearing a Scott mask or they're wearing an N95 with big safety glasses or anything like that. Again, we're just trying to protect all of you and protect ourselves also.
Thanks, Deputy. Questions from our viewers? Seeing none. Mary Beth, you touched upon contact tracing, correct?
Well, what contact tracing means is it's not a new concept. It's something that's done with infectious disease, where you have an individual who is affected by an infectious disease, and you start from there and go out to see who else is affected by that infectious disease to try to control the spread. So for example, right now during COVID-19, if we have someone who tests positive, I get in touch with that person and ask them how they're feeling and what their symptoms are. And then we look back in time. So when did your symptoms first start? And then we go back 2 days prior to their symptoms starting and say, you know, who might you have been in contact with? Who did you see? Who did you walk with? You know, who were you within 6 feet for 10 minutes or more with that could potentially be affected by this virus? And then we reach out to those people and tell them, you've been exposed to someone who's positive for COVID-19, and so you'll need to be in quarantine. And then we talk about what that will mean. A lot of us are using the term, you know, we're all in COVID-19 quarantine right now. Technically, you can leave your home for essential things, but somebody who's in quarantine is at risk that they might be incubating the virus. And so they could be in that, say, 48-hour window before their symptoms start, and could be if they go out and about sharing that virus with other people with whom they come into contact. So quarantine is the condition of someone who's been exposed to someone who's positive, who should not leave their home and should not have anyone come into their home. Isolation is the term for those individuals who are confirmed to be infected with the virus and need to be isolated and away from others.
Thank you. Question about outdoor activity. Somebody asked, why can't I golf? Walk the Audubon trails, walk the rail trail. Considering both surrounding communities still allow people to do that. Who wants to first take a crack at that one?
Well, I can start, I suppose, and then Regina, I'll turf it to you. You know, one of the reasons we thought about closing the rail trail is parking for us is a real problem. And, you know, the access to the rail trail from Route 97 is a dangerous spot for traffic, and public safety was really concerned, as you know, as was the Board of Health as well. Additionally, you may or may not be aware that in the Wenham portion of the rail trail, we have the Swamp Walk, which is not 6 feet wide. And so if you're out there on the Swamp Walk, you are not socially distancing from anyone coming toward you, or, you know, it's just not physically possible. Golf courses were closed by the governor. That wasn't a local decision. They are not considered an essential business. I believe there was a question about masking during outdoor activities as well. And so what I would say about that is we do want everybody to still get out and get some exercise. Do you need to wear a face covering if and when you're going out and getting your exercise? I would say it really depends where you're going to be. I'll speak from my own personal experience. In my own neighborhood, the streets are wide enough that I can walk, and even if I see a neighbor, we're able to be distanced from each other. So I don't usually wear a face covering. But when I go outside my neighborhood and I'm on busier streets, which would mean I would need to walk into the street or something, that's when I wear a face covering. I'm still going to move aside and try to make space between myself and someone else. So depending on where you're undertaking your activity outdoors, use your good common sense to think about, is this a place that I would need a face covering? If I'm walking on 97 and the sidewalk's only 4 feet wide, then that's probably a good time to have it with you. If you're someplace where the street is 30 feet wide, then there's going to be plenty of space for you to move apart.
Thank you. I know that with the rail trail, we did have quite a discussion at one of our many public health and public safety meetings, and with the unfortunate incident that happened up in Ipswich on 97, as the better weather was coming, it was really that increase of parking, and Captain DiNapoli can speak more of this, but we were really concerned that that was going to pose a public safety problem, as well as to what Mary Beth was referencing with the not having really enough space on that trail. Captain, anything else to add as far as that?
No, the biggest thing was, we noticed as we spoke about it in our meetings that leaving any room for interpretation is what causes the confusion with the folks. So any ambiguity at all, we just wanted to take that away, and that's when we added that extra posting. And some of the residents were calling, and they were frustrated with the added extra parking on the side streets by the rail trail. And we had to explain, without the proper authority on our end to take action, it's not against the law to park on a legal way on a side street. So when the Board of Health and the selectmen gave us that extra authority to go ahead and post it, it made it a lot easier on us, because it gave our guys the ability to take action if we needed to. And the residents seem certainly happier with the lack of added foot and car traffic on the side streets.
In keeping with you, Captain, closing thoughts for our community?
Just that we're out there, we're all in the same boat. We're everyone's kind of taking day by day changes as everything continues to evolve. Where the biggest thing with us is that folks know we're visible, we're accessible, we're available. We're taking as many phone and email reports as we can to avoid, when it's not necessary for us to do our job effectively, we're going to limit that physical contact for everyone's peace of mind. But other than that, we're doing everything that we normally do, and everyone's been on the right team and the right side to make it work. And everyone's outside their comfort zone in one way or another across the board. And I think my son said, he's 17, and he says, "Dad, I'm getting used to the new normal." And it's so true. People are starting to get used to the less cars on the road. I think the first couple of weeks were harder on everybody. And now that we're kind of getting used to what's accepted and what we need to be doing, I've seen a lot of cooperation that it's making it easier on everybody.
Thank you, Captain. Chief Kavanaugh, closing thoughts.
I think this town has done a great job dealing with this crisis. And basically, the best way to help us, stay home. And if you have to go out, social distance, and please wear a mask. That's the best way to help everyone.
Thank you, Chief. Regina?
Just again, we're all in this together, just to reiterate the thoughts that we all have. And the Board of Health, our goal is to keep everybody safe, both sides of the fence, and to work together and get through this together. And again, like Chief Kavanaugh, I think everyone is doing a great job. We're all nervous together, and we will get through this.
Thank you, Regina. And Mary Beth.
I would just want to say thank you to the residents of town for your attention and your interest and your questions. I want to acknowledge that, you know, with some of the questions about outdoor activities, it doesn't make anyone happy to have to make decisions to close down access to things that we all enjoy. We are asking all of us, every single resident of Wenham, to do things that are very difficult and uncomfortable. And, you know, I'm very sorry about that. I wish it weren't this way. My kids wish it weren't this way. None of us want it to be this way. But I'm hoping that as we are all vigilant in doing our individual part, we'll get to the other side, hopefully that much quicker and safer. And I appreciate everyone's cooperation. Thank you so much. And please do let us know at the Board of Health and at Town Hall any way that we can be of assistance to you.
Thank you. And I just want to thank our panel today. Truly, we have a wonderful, outstanding team that has really been on top of this issue early on. And I think that our efforts early on has contributed to our where we are right now. And also want to thank the leadership of Board of Health and the Board of Selectmen, who have been tremendous partners in dealing with this virus. And if there's ever any questions, I'm at Town Hall. Feel free to give us a call. You will get that call back. Email, we're here, and we're still working for you, Wenham. So thank you all for joining us, and everybody please stay safe.
Thanks, everyone.
Thanks, Regina.
Thank you.
Thanks, Chief. Thanks, Captain. Thanks, Anthony. Thanks,
Yeah,
Jim,
thank you.
Jackie.
Thanks, everybody. Yeah,
Jeff.
thank you. Bye-bye.